Hi, today I'm doing my presentation on stroke. I chose stroke for my topic for this second video because it comes close to home. My grandma had a stroke and we didn't know much about it at the time, and I wasn't in nursing school, so I would have loved to have known the facts I know now about a stroke. So I wanted to teach more people because stroke is pretty common, and I think that being able to know warning signs and everything is really helpful, and people could benefit from it and hopefully prevent a stroke or lessen the severity of a stroke. So backwards. So the learning objectives of this course are we're going to do an introduction about what it is. We're going to go over signs and symptoms, risk factors, prevention, treatment, statistics, and then a conclusion. So what is a stroke? And the classifications. So there are two classifications of a stroke, one being an ischemic stroke and one being a hemorrhagic stroke. And the definition of a stroke to begin with is the blood flow to the brain is obstructed, so there's a lack of oxygen to the brain. So this ischemic stroke also has two classifications underneath it, and that's a thrombotic stroke and an embolic stroke. And then for hemorrhagic stroke, there's an intracerebral hemorrhage and a subarachnoid hemorrhage. And then we're going to talk about each one in the next slides. So the first one we're going to talk about is ischemic stroke. So again, there's two classifications that fall under ischemic stroke, and the first one being thrombotic. And this type of stroke occurs when there's a blood clot, which can also be called a thrombus, and it forms and blocks blood flow through the artery in which it's formed. The blood clot may block the flow of oxygen-rich blood to a portion of the brain, causing long-term brain damage. So if a thrombus gets lodged somewhere in one of the arteries, then it can block flow of oxygen to the brain, which would then cause a thrombotic stroke. The other type of ischemic stroke is embolic, and this occurs when a blood clot or cholesterol plaque wanders into the brain and becomes trapped inside an artery. A cholesterol plaque could be if you have bad cholesterol, and that could be from eating fatty foods such as burgers, steak, anything like that. This stroke often results from heart disease or heart surgery and occurs rapidly and without any warning signs. So again, heart disease, if they have bad cholesterol, they'll probably have atherosclerosis, which can lead to heart disease or anything. So with these strokes, you have to be cautious about all the other medical illnesses a person may have that could lead to a person having this type of stroke or any stroke in reality. And then the second classification is the hemorrhagic stroke. And then under these two, there's an intracerebral hemorrhage. So this is caused by bleeding within the brain tissue itself. This is a life-threatening type of stroke, and it's most commonly caused by hypertension, arteriovenous malformations, or a head trauma. A lot of Americans have hypertension, so it is important that if you have hypertension, you're taking your medications, you're trying to lower the hypertension by exercising or following your doctor's orders of how you handle your hypertension. The second type of stroke is a subarachnoid hemorrhage. This, again, is another life-threatening type of stroke, and these are both life-threatening because it's occurring in the brain and it's hemorrhage, so that means the blood is stopping and not getting to the brain, which is not good because then it means the brain is not getting oxygen that it needs. So again, it's a life-threatening kind of stroke, and it's caused by bleeding into the space surrounding the brain, which is the subarachnoid, hence the name of the stroke. And this may be caused by a ruptured aneurysm, again, an arteriovenous malformation, or a head injury. So with either of these, it could also be from like a car accident, or if you have a fall and you land on your head, or anything of that sort. So recognize a stroke. there's a quick YouTube video.
Just as putting out a fire quickly can stop it from spreading, treating a stroke quickly can reduce damage to the brain. If you learn how to recognize the telltale signs of a stroke, you can act quickly and save a life, maybe even your own. For both men and women, look for these 5 signs of a stroke, all of which come on suddenly. 1. Numbness or weakness in the face, arm, or leg, especially when felt on just one side of the body. 2. Confusion, including trouble speaking or understanding speech. 3. Trouble seeing, from one or both eyes. 4. Trouble walking, or problems with balance or dizziness. 5. Headache, especially a severe one that comes on suddenly. The clock begins ticking as soon as you spot the signs of a stroke, because some treatments can only be used if the patient reaches the hospital in the first 3 hours after symptoms appear. So don't wait. Call 911 right away and get the person to a hospital immediately, even if the symptoms go away. If you think someone is having a stroke, remember the word FAST. F is for face. Ask the person to smile and check whether one side of their face is drooping. A is for arms. Have the person raise both arms and see if one arm drifts downwards. S is for speech. Ask the person to repeat a short phrase and notice if their words sound slurred. And finally, T is for time. If you spot any of these signs, call 911 right away to get the person to a hospital fast. Strokes are medical emergencies. The sooner a patient gets treatment, the better their chance of a good recovery.
Okay. So that was, again, just recognizing a stroke and ways you can recognize a stroke. So FAST is the acronym, but it was just recently changed to BFAST. And this is how you recognize the signs and symptoms of a stroke and how it happened. So the B stands for balance. A person's balance may become off. They might become dizzy. E is for eyes. Have they lost any vision in one or both eyes? Face. F is for face. Again, so you may see drooping in one side of the face. So if they smile, the one side might not go up, it might go down, and the other will go up. A is for arms. Excuse me. They may have tingling in an arm. It might be weak or numb. They may not be able to feel the one side. So look out for that. S is for speech, and it will be slurred. If you think that somebody is having a stroke, you can ask them to say a sentence and listen to their speech and see if it is slurred or not. And then T is time. As soon as you see any of these start happening and you think that the person may be experiencing a stroke, time is very important, and you want to make sure to call 911 right away, because the quicker you can get there, the more likely you that you can recover from a stroke better. So signs and symptoms is the BFAST, all of those, but just a little bit more in depth is sudden weakness or numbness. So a sudden loss of strength, sudden numbness in the face, arm, or leg, and even if this is temporary. So it may come, all of these are even if it's temporary. Something may happen, and you shouldn't just ignore it, especially if you have many of these signs or symptoms. You want to make sure that you're calling 911 right away. You'd rather be safe than sorry. Sudden trouble speaking, so that's the S for speech. They may have difficulty speaking or understanding sentences or what they are saying. They will have sudden confusion as well. So again, talk to them, ask them a sentence, ask them to repeat it back to you, see if they understand the sentence or if they have slurred speech when they are speaking the sentence back to you. Sudden vision problems, they may have trouble with any type of vision. It may be in one side of the eye, it may be in both sides. This may also throw off the balance, so just make sure that if any of these occur, then you're calling 911, even if any of them are just temporary. More signs and symptoms is a sudden headache. It could be severe and unusual. Many people do suffer from headaches, but this on top of any other symptoms, or if it's unusual and it's not like any other one, should be a warning sign that you may be having a stroke, or a person you know is having a stroke. Sudden dizziness. So they may have the sudden loss of balance, especially with any of the above signs. So it kind of relates. They may have the slurred speech and also be walking weird. They may have bad vision, which is throwing them off balance. So any of these signs, symptoms together really is your warning sign to call 911. The face is really visual, so you should be able to see that right away. The arm or numbness or anything, you might be able to tell because it may look heavy to them, or like they can't feel it or anything. So you really just want to look for it, but also ask them questions to make sure that you fully understand what they are going through at the time. So risk factors of a stroke. There are two types of risk factors. There's modifiable and non-modifiable. So for non-modifiable, it's a factor that cannot be changed, and modifiable is a risk factor that can be changed. So going over non-modifiable risk factors: age, above 70 or above 55 years old. A person can't change how old they are, so that makes it classified under non-modifiable. But the older you get, the more likely you are to have a stroke, unless, again, it is one of those hemorrhagic strokes. That can be caused by head injury or anything like that, so that puts them at risk. Family history. So if a grandparent had a stroke, if your parent had a stroke, there is a family genetic thing for strokes. It may be because it increases your chance for a blood clot or anything. So if you have a family history of strokes, you should be aware of the warning signs and any other risk factors to see if you probably have a risk of having a stroke. Gender, it's more common in women than men. So that's a risk factor, and again, just being aware of that. So if you're a 55-year-old woman, then you're more at risk, especially, and if you have a family history of it. And then another non-modifiable thing that you can't change is ethnicity. So high-risk groups are Asian and African American. They are more likely to have a stroke. Modifiable risk factors, so medical conditions. There's previous stroke or TIA. So a TIA is a small stroke. This is modifiable because you can prevent a stroke, and we'll talk about that again later, but you can prevent a stroke through different habits. High blood pressure, hypertension. Like I said, hypertension is a big risk factor. But again, if you follow your medication regimen and you exercise, you eat right, you follow the DASH diet, then it's lowering your chance for having a stroke. High cholesterol, make sure that this is modifiable because you want to be able to make sure that you can eat what you're supposed to eat. You're not eating those fatty foods like the burgers, the steaks, anything fatty really. Heart disease goes hand in hand with high blood pressure, high cholesterol, anything like that. Just want to make sure that you're following your doctor's orders and making sure that you are preventing a flare-up of the heart disease, which could later cause a stroke from occurring. AFib is known to cause strokes as well. So most patients who do have AFib are also on medications to prevent a stroke from happening. And also diabetes. Again, it could be because of your diet, your clogging arteries or anything. It puts you at a higher risk. But all of these medical conditions are modifiable because even though a patient may have one of these diseases or conditions, they're able to maintain the condition and try to keep it balance, so that if there is a flare-up, then it could cause a stroke. So they want to try and prevent that. Modifiable risks that are lifestyle, so things that you can change through lifestyle, is sedentary lifestyle. Also overweight, so watching what people eat. Again, eating has a lot to do, or a good diet has a lot to do with keeping healthy, and it corresponds with a lot of different conditions. So you want to make sure that the patient has a healthy diet and is following any specific diet that they may have been given. Excessive alcohol use is a risk factor. So a patient should really, if they do drink alcohol, they should limit it as much as they can, because that reduces their risk for having a stroke. A stressful lifestyle. So many people are stressed. My last video talked about stress and how to relieve it. So stressful lifestyle just makes the body work harder, because the body is stressed because you're stressed. So it's important to try to find ways to keep yourself less stressed. Like I talked in my last video, find the person's stressors to try to prevent them from happening, which in return could help prevent a stroke from occurring. Smoking, you want to make sure that your patient is smoking cessation, because smoking and alcohol together also just aren't a good combination. And then cocaine or ecstasy use also puts you at a greater risk. So stroke prevention. As I talked about, you can prevent a stroke from occurring. And if you already had a stroke, or TIA, you can prevent another stroke from happening by following these. So you're changing your lifestyle choices as previously stated in the modifiable risk factors. So you could go on mild blood thinners, which they decrease the possibility of the body forming a clot in the blood. These include aspirin, and aspirin is used for prophylaxis of a TIA and or stroke. So a patient who may be more likely to develop blood clots, so maybe a person who is on a contraceptive, or a patient who already has a family history of stroke who has blood clots, they may be put on aspirin to prevent a small stroke from occurring or a regular stroke from occurring. Another mild blood thinner is Agrinox, and this is used to reduce the risk of stroke in patients who have had a TIA or completed ischemic stroke due to a thrombus. So this patient would have already had a small stroke, or they could have had a stroke, an ischemic stroke through a thrombus, as we talked about earlier. So they would be put on Agrinox to try and prevent another stroke from occurring. Plavix is also another common blood thinner. You also hear this one a lot in the hospital, and this is used to reduce future atherosclerotic events, so a stroke. As talked about, atherosclerosis is the hardening of the arteries, which makes it harder for blood to flow through and to flow through the brain to the brain, which will then result in low oxygenation to the brain, which would cause a stroke to occur. So they would be put on Plavix, and they are also on it if they had a recent stroke. Continued stroke prevention, they may be put on clopidogrel and aspirin combined. This combination is used to reduce future atherosclerotic events in patients with a recent stroke or patients who had a stroke while on clopidogrel. So if a patient was already on this, and they have a stroke, they may add aspirin to it to reduce the risk, because again, aspirin's a mini blood thinner, so it's thinning the blood on top of the combination with the clopidogrel. And then the other one is Tislin. This is used in patients to decrease the risk of stroke or the occurrence of another stroke. A lot of these blood thinners are to prevent a stroke or prevent another stroke from occurring. So a lot of the time, that patients have a stroke, they will be put on one of these blood thinners. Or if they have a family history or they have many risk factors, then a doctor may prescribe any of these blood thinners to help prevent a stroke from occurring. However, Tislit, due to its life-threatening rheumatologic disorders, it should be reserved for patients who are allergic to aspirin. So that's usually only given if a patient is allergic to aspirin because it can cause a rheumatologic disorder, which could be life-threatening. So obviously that's more risky than putting a patient who is not allergic to aspirin for stroke. Continued stroke prevention. So this is stronger blood thinners, which is warfarin or Coumadin. And again, we learn a lot about this in school. This is what my grandma was on also. So this is used for the treatment and prophylaxis of a pulmonary embolism, a venous thrombus, and thromboembolic disorders, and to prevent a recurrence of a TIA. It's used in stroke patients, and warfarin is most often used to prevent a cardiogenic embolism due to AFib. Again, AFib can cause a stroke. So a lot of the time, if a patient does have AFib, they are put on warfarin to prevent a cardiogenic embolism from occurring. Patients beginning warfarin will need to have weekly lab tests done to evaluate and stabilize their therapy. So they will need an INR test done to make sure that the therapy is working effectively. Excuse me. More stronger blood thinners, I'm wrong. Acute treatment of a stroke. So TPA. This is a reason why if a patient does have a stroke, you want to make sure you call 911 right away, because the faster a patient can get to the hospital, the more likely they are able to use TPA, which is a treatment for a stroke, and I'll talk more about it. TPA is the use of drugs to break up the clot that is causing the disruption in blood flow to the brain. So if a patient is showing signs or symptoms of a stroke and they get to the hospital and early enough, then they may be able to break the clot before it becomes a full clot, which will cause no blood flow and oxygen to the brain. So TPA would be able to stop the clot from closing, which would then allow blood and oxygen to continue going to the brain, which will cause this stroke to hopefully not happen or be less severe. The importance of getting to the hospital as soon as possible after noticing the warning signs of a stroke. The length of time between the first warning signs and the time you get to the hospital may directly affect your recovery. So the faster you get there, the more likely your recovery should go better for the patient. Patients who present to the hospital within 3 hours of the first sign of a stroke have the possibility to receive Activase. And Activase is a clot buster that breaks up the clot to restore blood flow to the area of the stroke. So the minute you you see someone having a sign, or if you are having a sign of a stroke, you want to start keeping track of what the sign or symptom was, when it occurred, if any other signs or symptoms happened. But you want to make sure that you really note the first sign and what time it occurred, so that when you get to the hospital, you're able to tell them when it happened, when it occurred, and if it's within 3 hours of you getting to the hospital, you're more likely to be able to get the Activase and the TPA to help prevent the stroke from becoming really bad. So continued TPA treatment. Prior to receiving treatment with TPA, the patient should expect to have a brain CAT scan. So as soon as, not as soon, but within a patient getting to the hospital, they're going to have to get a bunch of tests done, and a CAT scan is one of the first things. And this is because there are several medical conditions that make it too dangerous for a person to receive TPA. So the CAT scan is not only going to be looking at the brain to see if they see a clot anywhere in the brain or see if they see a bleed in the brain. it's also going to see if there's any risk factors for the patient receiving TPA. And the conditions that would make a patient ineligible to receive the TPA would include a hemorrhagic stroke. So like I said, a bleed in the brain or outside of the brain or anything like that. A brain aneurysm, recent surgical procedure, any head injury, bleeding or clotting disorders, pregnancy, or trauma. So if a patient has any of these, then they are not able to get the TPA, and another way of treating the stroke needs to occur. So that is why it's extremely important that once the patient gets to the hospital that they receive a CAT scan, because the faster they get a CAT scan, the faster they see if they are eligible for the TPA, and the faster they're able to give the TPA if they are able to get it. So some statistics about stroke. Sorry. Stroke kills about 140,000 Americans each year. That's 1 out of every 20 deaths. So again, stroke is a pretty common illness. So you want to make sure that you are aware of your family history of stroke, any risk factors you have that could cause a stroke, and really know the Be FAST acronyms so that if you think you're experiencing a stroke, you know what to look for. Another statistic is every year more than 795,000 people in the United States have a stroke. About 610,000 of these are first or new strokes. So that's a lot. About 87% of all strokes are ischemic strokes in which blood flow to the brain is blocked. So that could be from atherosclerosis or a thrombus, which is causing the clot somewhere in an artery, which then is obstructing blood flow to the brain, so the brain is not getting the oxygen it needs, causing the ischemic stroke. And that's 87%. High blood pressure, high cholesterol, smoking, obesity, and diabetes are leading causes of the stroke, and 1 in 3 U.S. adults have at least one of these conditions or habits. So as I said before, a lot of people in America do have hypertension, they do have high cholesterol, there is obesity, diabetes is common, and smoking. So there are a lot of people out here who are at high risk for a stroke. So for these people, it is really important for them to maintain their medical regimen or their diets, or to stop smoking, to help reduce their risk of a stroke from occurring. Because, as I just mentioned, a lot of people have strokes. So, a conclusion. So a stroke, it is a sudden death of brain cells due to the lack of oxygen, which is caused by a blockage of an artery or a head injury or a trauma or anything like that, that is causing blood flow not to get to the brain, which is causing no oxygen to get to the brain. Symptoms are weakness, paralysis on one side of the body, difficulty with balance, difficulty with speaking, difficulty with swallowing, bad vision. Again, just remember the acronym Be FAST. And if you can't remember Be FAST, FAST was the original one, but it's balance, B, eyes for E, F is face, A is arm, S is speech, and T is time. And again, time is very important because you want to be able to get to the hospital, because the sooner you get there, the sooner you are able to find out if you're able to get the TPA. Preventative medications include mild and strong blood thinners. So again, the aspirin, the Agranox, are mild blood thinners. Warfarin is a major strong blood thinner. And again, if a patient is put on warfarin, then they are also getting lab tests for their INR. Clot-busting drugs such as TPA can be used to reverse a stroke. Again, get to the hospital as soon as possible. Prevention is minimizing risk factors, whether it's controlling your high blood pressure, high cholesterol, diabetes. These are your modifiable risk factors that a patient or person is able to change. And again, call 911 immediately or get to the hospital as soon as possible if you are experiencing or you see somebody experiencing the signs and symptoms of a stroke. The faster you seek help, the more of a chance you have for recovery. So call 911. If there's one thing to remember about stroke is the BFAST acronym, and to call 911 as soon as possible when any of these signs or symptoms are occurring to a patient or to yourself. And then these are my references. And that is the end.